This installment of the Crucible examines the problems caused by sharing too much information with patients. And there are two papers. The first one comes from the journal Rheumatology, and it's titled Patient Information Recall in a Rheumatology Clinic. The study involved 151 patients who visited a rheumatology clinic for routine care. Exit interviews were used to determine the patient's recall of information provided during the visit. The patients correctly remembered 40% of the information they had been given. They misconstrued 48% of what they thought they remembered. So only half of what they thought their doctor said was correct. And finally, when patients were given more information, the proportion that they correctly remembered was lower. The second study comes from the journal Clinical Pediatrics, and it's titled Parental Recall After a Visit to the Emergency Department. This study also used exit interviews to question parents about the care their child had just received in the emergency department. And as everyone knows, when you're discharged from an ED, you receive both verbal and written instructions from several members of the healthcare team, and if it's your child who's sick, most people are going to pay attention. Despite that, 25% of parents stated their child's diagnosis incorrectly. 42% did not know the details of their child's follow-up, and 70% did not know the name of their child's medication. Now, to those of us who've seen a patient, these results aren't terribly surprising. Let's talk about why they're medically important. One of the most popular risk management strategies involves sharing lots of information with the patient. It's commonly said that if you want to lower your legal risk, you should tell the patient everything. And this recommendation is based on a belief that patients file lawsuits in order to learn what happened. So if they're suing us to get information, let's just give them the information, all of the information, and save ourselves the lawsuit. That's the thinking. Of course, the premise is flawed because lawsuits aren't about finding answers. I know people say they are, but suing someone guarantees that they'll hide behind their lawyer and never tell you anything, but that's not my point today. Let's assume that lawsuits are about finding answers. They're not, but let's assume they are. The problem is that even if we assume lawsuits are filed to obtain answers, these studies suggest that sharing large amounts of information isn't going to prevent them. You see, what the experts are missing is that there's only so much information a person can process and remember. And when they're ill or injured, as many patients are, the amount is probably less. And as a result, no matter how much information I share and how well I share it, there are significant limits to what patients can remember. And when we overwhelm them, which is what the medical legal experts recommend, all we do is increase the risk that they won't remember the important things, or even worse, incorrectly remember them. If the goal is to reliably impart vital information in a memorable manner, then physicians should limit their communications to those pieces of information which are most important to the patient's well-being. Over time, as the patient is able to comprehend and remember, it may be appropriate to share additional information. Now, as sensible and patient-centered as that approach is, the medical legal community has condemned it. They view it as withholding information from patients. And of course, this is a form of medical paternalism where the doctor decides what the patient should know, and this is a relic of the past which is completely unacceptable. Regardless of what you think causes lawsuits, the current risk management strategy of dumping large amounts of information on people who cannot remember it is deleterious to patient care. Thanks for listening.